Hi, I'm Dr. Liz Perry, Doctor of Acupuncture and Oriental Medicine, where life becomes better living. We will talk to you today about different types of hernias, and very specifically, the hiatal hernia and the two different types of that type of hernia. So first and foremost, hernias, there's many different types of hernias. There are epigastric hernias, femoral hernias, diastasis recti hernias, inguinal, umbilical, incisional hernias, and hiatal hernias. There's the paraesophageal, diaphragmatic, and obturator hernias as well. So the bottom line is the hernia is the bulging of an internal organ through a weak area, and most of them occur in the abdomen region. So today we will talk very specifically about the hiatal hernia. The hiatal hernia. Hiatal hernia is, there are two different types of hiatal hernias. One that occurs in the upper portion of the stomach, typically all hiatal hernias, and they bulges into the opening of the diaphragm. There is the sliding type of hiatal hernia and the paraesophageal type of the hiatal hernia. Treatment for both of them in biomedical science is the same. And similarly, somewhat the same as well in traditional Chinese medicine and functional medicine. So a couple things that will help you right out the gate is first, I just want to make sure everybody understands what is a hernia. So a hernia is when their muscle becomes weak, and it specifically with the hiatal hernia grows up into the diaphragm region and opens into a weakened area within the diaphragm and bulges through. So that is bulges through an opening in the diaphragm. So one thing you don't want to do when you have this type of a hernia is do not eat before bed. That has to stop if it ever did start. Do not eat before bed. Another thing you can do to make yourself more comfortable and lessen the GERD and improve the breathing, if those are symptoms, with your personalized hiatal hernia, is elevate your head while sleeping. And if you do smoke, I highly suggest that you quit smoking. Now, another good idea on lifestyle changes if you have been diagnosed with any type of hiatal hernia is to stay hydrated. Drink plenty of water, room temperature water, or even a little bit warm water. High pH water is preferred because so the organs maintain a higher level of absorption this way, and so that the body can stay more effectively hydrated. Foods to eat: apples, bananas, pears, and prunes. Fiber-rich greens and fiber-rich vegetables are great choices if you have been diagnosed with any type of a hiatal hernia. Oatmeal is another good choice. What to avoid? Avoid strenuous exercise. Small, light meals are a good choice. Exercises such as swimming or walking or very light cycling can work if you have a hiatal hernia. Best to avoid any type of overexertion. So thanks for checking in. Dr. Liz, Doctor of Acupuncture and Oriental Medicine, where life becomes better living. Today's topic is the hiatal hernia, and it's best to work with an acupuncture physician about this so that you can optimize your wellness plan. Thanks again for checking in. If you liked this wellness tip, or if you suffer from any type of hiatal hernia, please feel free to like and subscribe to our channel so we will keep these wellness tips coming your way. One of the other things in traditional Chinese medicine, the pathogenesis of any type of a hernia is where there's a weakening of the sphincter and or a weakening of the muscle tissues, which is why it tears and punctures through from the stomach to the diaphragm, is called spleen qi deficiency pattern. And that means in traditional Chinese medicine, the spleen is responsible for the holding of everything from a blood vessel to your muscles. The spleen dominates the muscles and the lips and the tongue and many other insights. So when the sphincter is weak, that is due to, according to traditional Chinese medical theory, it is due to spleen qi deficiency, as is the type of stroke if you have a bleed, as opposed to a blockage. That would be known as spleen qi deficiency, as is the muscle bulging in the case of a typical hernia and either type of the hiatal hernias, be it the sliding and or the paraesophageal. Those are both considered pattern differentials of a baseline framework known, according to traditional Chinese medical theory, as the spleen qi deficiency. So, how do we improve the condition or avoid any further types of hernia activity? We tonify the spleen. And how do we do that? Through food therapy, some of such that I just mentioned to you that will tonify the spleen. But furthermore, acupuncture and the traditional modification use of traditional Chinese medical formulas to tonify the spleen are also a very good choice. Furthermore, one final tidbit for those folks that are suffering from any type of hernia, even though today's topic was very specific about hiatal hernias, is drink and eat warm water. Stay away from cold drinks and raw cold foods. Too many salads, sushi, ice cold drinks, cold beers and martinis. Those are all considered cold, raw drinks and foods which weaken the spleen. So don't do that. If you're overweight, lose some weight. Work on losing some weight through improving the diet, light walking, light cycling, and swimming. So again, thanks so much for checking in with Dr. Liz, Doctor of Acupuncture and Oriental Medicine, where life becomes better living. And please feel free to like and subscribe to our channel, where we will keep these wellness tips coming your way. And jusqu'à demain.